The 3 Steps to Become a Registered Nurse, brought to you by medicalfieldcareers.com. What does the job outlook for registered nurses look like? According to the latest statistics from the U.S. Bureau of Labor Statistics, the field of nursing is adding over 438,000 jobs over the next decade and is growing at 15% over that period. That is tremendous growth. The median pay is $70,000 per year and $33.65 per hour for working nurses across the country. With the baby boomer generation needing vast amounts of health care and living much longer than previous generations, the need for skilled healthcare and medical field professionals like registered nurses is extremely high and will continue to be just that. Include the high amounts of immigration every year, and the demand does not have an end in sight. Time could not be any better to become a registered nurse, and we could not be more excited about the career as a whole. What is the process to become a registered nurse? All registered nurses have 3 pathways to licensing. First is a BSN, Bachelor of Science degree in nursing. Second is an ADN, Associate's degree in nursing. Third is earning a diploma from an accredited nursing program. The steps to become a RN are simple in theory, but take time and careful decision making along the way. We will do our best to make that easier for you. Let's take a look at the steps needed to become a registered nurse. Step 1, find the right nursing school. Step 2, complete your RN program and pass the NCLEX-RN. Step 3, find a registered nursing job. Step 1, select the right RN program for you. Nurses are the gateway between patients and physicians, and in many situations, the voice for the patients who cannot advocate for themselves in the healthcare system. Registered nurses can bring happiness into a situation where most would think sadness would prevail. It is a huge responsibility to be a nurse, and those who are get a huge reward and gather huge personal satisfaction from the ability to assist someone in need. Many begin the process with entry-level allied health positions, but aspire to climb the ranks within the nursing field with continued education. When selecting a RN training program or nursing school, looking at the schools nearest you is the best way to start. Make note of them and check their NCLEX-RN pass rates and graduation rates. You may want to see examples of coursework if possible to get a feel of how they go about teaching in their programs. Check social media for more information. It is remarkable what you can find on Facebook, for example. For a list of accredited nursing schools near you, see the ACEN, the Accreditation Commission for Education and Nursing database, or the CCNE, Commission on Collegiate Nursing Education databases of approved RN programs. Passing the TEAS test for nursing school entry. Passing the TEAS test is a mandatory prerequisite for entry into registered nursing school. We cover the details of the TEAS tests. TEAS is a timed test that only has 4 multiple choice options for each individual question. Each of the 4 areas have different maximum time allotments, and each has a different number of questions. The TEAS test is broken up into 4 parts: reading, math, science, and English. Take a moment to take a look on the right at the different time allotments for each individual section. Step 2. Complete your RN training and pass the NCLEX-RN exam. If you are on the path to becoming a registered nurse in your respective state, you will have to pass the NCLEX-RN to be eligible for nursing licensure. What is the NCLEX-RN? The NCLEX-RN is the final examination for aspiring registered nurses before they receive their license to be employed as nurses in their respective state. For more information about frequently asked questions for the exam, see the NCSBN FAQs page. You will find all the details from the organization that gives the examination there. Also, see their test plan page to get intimate preparation planning for the exam tailored just for your needs. Let's take a look at the NCLEX-RN pass rates in the United States. Below are the first-time pass rates for students who took the NCLEX-RN from 2010 to 2017. For more details about the pass rates and the test itself, see the NCLEX-RN fact sheet provided by the NCSBN, who is the provider of the NCLEX test. The National Council of State Boards of Nursing is the partner of the state boards across the country that does testing for all registered nurses. Step 3. Finding a registered nursing job. Upon the passing of the NCLEX-RN and receiving your nursing license, you are then eligible to find a job as a licensed RN. We will show you some great tips and ways to get started on the job search successfully and in a way that serves your career and future. First, let's take a look at how to make a great registered nurse resume. Here are some basic resume tips for your success. First, make your name pop and stand out. Second, list your email along with phone number, address in a clear way that can be found easily. Third, correct all spelling errors and grammar, proofread, and have someone else proofread it. And 4, stick to clean, basic fonts and make it short and simple. If you do all these, you'll be on your way to becoming a registered nurse and getting your first job in the nursing field. Before you go, check out our annual healthcare scholarship. Come to medicalfieldcareers.com and fill out the scholarship application and submit your 1,000-word essay on why you would like to work in the nursing field, and maybe you can get some of your RN education paid for by us.